This concludes session 2. Special thanks go to Ms. Che and all the panelists for a great session. Without much ado, let me invite you to our next session titled National Experiences from COVID-19, Designing Risk Reduction Measures, Relief Plans, and Recovery. Session 3 consists of a series of pre-recorded video. I will be intervening as necessary, but very briefly, to introduce speakers. So allow me first to direct your attention to our first video, which is from Ms. Francesca Perucci, who chairs this session.
Hello, everyone, and a warm welcome to this third session of the International Conference on the Role of Data and Statistics in Understanding and Mitigating Risks. I'm Francesca Perucci, Assistant Director of the United Nations Statistics Division, and I will moderate the session. The title is National Experiences from COVID-19, Designing Risk and Reduction Measures, Relief Plans, and Fostering Recovery. We will review national experiences from COVID-19 and other crises, and in particular, the role of national statistical systems in addressing and managing the crisis and data-based and science-based COVID-19 policies. We have a lineup of very distinguished experts today for this session, and it is my great pleasure to introduce our first speaker, Mr. Juan Daniel Oviedo, Director General of DANE, the National Statistical Office of Colombia. Juan Daniel Oviedo was appointed Chief Statistician of Colombia in August 2018, after having served as Director of Institutional Planning and Research and Director of the PhD School of Economics. He also holds a permanent academic position at the Universidad del Rosario of Bogota, Colombia. His areas of research include regulation economics, industrial organization, and network economics. Dear Juan Daniel, you have the floor.
Thank you very much, Francesca, and I'm very happy to see you again. And let me first thank not only the United Nations Statistical Division, but also COSTAT for organizing this important conference, and more specifically, this conversation that I'm sure that is going to be tremendously important in order to share experiences of how the national statistics systems face the main challenges of the COVID-19 pandemic. From the Colombian perspective, one of the main issues that we wanted to highlight is that the developments of the international statistical community since 2014 were very important in order to allow the Colombian national statistics systems to be a hands-on perspective in the current pandemic. Since 2015, we have been developing and improving the institutional and organizational perspective of our national statistics system that since 2019, we have approached from a data ecosystem under which the perspectives of the data stewardship approach that has been developed during the last years was appropriated from a coordination perspective of co-production of statistical information from several stakeholders or co-producers of information in our country. Additionally, the institutional framework of our national statistics system not only performs an advisory council, but also puts into practice the data stewardship inside a data stewardship committee that is aligning the production of statistical information from public policy perspective, something that was essential to provide sound answers during the current pandemic of the COVID-19 situation. One dimension that we would like to highlight in this conversation is that related with the challenges and adaptation strategies that we managed to put into practice in order to provide continuity of statistical production in our country. As you may know, Colombia was used to an in-person way of grasping the statistical information, more specifically from the social indicators of our country. Rapidly, the lockdown measures made us accountable of developing new methodologies that were either telephone assistance or internet assistance in order to grasp this important information from the social perspective, more specifically, the labor market indicators that we produce in a monthly way in our country. In that perspective, the institutional framework of the National Statistics Office had a very important change because we need to develop inside the National Statistics Office interdisciplinary groups that we call tiger teams in order to design, implement, and monitor the new developments from the methodological perspective that we were in a very fast way were managed to put into practice in our country in order to provide continuity. But the local way or the local perspective of facing these methodologies was supported from an international network of institutions, for example, the United Nations Statistical Division and the OECD and the Regional Agency for Latin American and Caribbean countries, ECLAC, that help all statistical offices to feel together as regards us facing these challenges, something that was very important in order to foster some innovation practices, but also a learning community perspective of sharing of our experiences and learning from the advances of neighbors or some leading countries in our region. At the same time, the pandemic was very, very, very effective in accelerating the use and dissemination of statistical production based from administrative records. In the case of Colombia, since 2015, for example, we were looking forward to using the Social Security administrative records and the labor market contributions administrative records in order to better understand the dynamic of the formal perspective of the Colombian labor market, under which the difference between formal and informal labor market is essential to understand in order to see how both sides of our labor market were facing the challenges of the COVID-19 pandemic, more importantly, in the limitation of the well-functioning of our labor market in our country. From an additional perspective, the pandemic was very, very demanding of new sources of information. For example, in our country, people aligned with the international perspective were looking forward for some other indicators, for example, subjective well-being indicators, not only from the household perspective, but also from the business perspective. That's why we needed to develop new statistical operations during the pandemic. And this was very effective in terms of going to the best practices from the international community that was allowed from this strong international network of statistical capabilities that has been deployed during the last years. And we managed, for example, as you might see in the slide, to develop two novel statistical operations. One that is approaching subjective well-being from the household perspective, and another one which is approaching the business well-being or the business sentiments during the pandemic from the entrepreneurial perspective in our country. With these two novel statistical operations, we were able to provide sound answer to this demanding environment of statistical information during the COVID-19 pandemic. At the same time, And as a third issue that we would like to highlight, we were facing challenges in order to better access or to better communicate to our stakeholders. For example, we needed to empower our local authorities in order to take advantage of the disaggregated information that we produce, not only from the social, but also from the economic perspective, in order to foster evidence-based decision frameworks from the subnational perspective in our country. But at the same time, we needed to better align our incentives of co-production of the statistical information or better exchanging administrative records for statistical purposes, for example, with the central bank, some line ministries, subnational agencies in our country, and more importantly, with civil society organizations. At the same time, we needed to diversify our communication strategy because we need to access lockdown dwellings under which they were more exposed to social networks, they were more exposed to internet streamings of our dissemination platforms that more traditionally we only use broadcasting or radio broadcasting in order to disseminate our results as regards to statistical production. For example, we developed what we call our statistical briefs that are some narratives that we build up from statistical information that we continuously produce during the pandemic. And for example, in these statistical briefs, we are managing topics which are very, very hot topics, let's say, during the pandemic, as the issue of loneliness, what's happening with mental health, what's happening with migrants or Venezuelan migration profiles in our country, and more specifically from a gender perspective, what's happening with menstrual health management in poverty-exposed women in our country. And at the same time, we needed to approximate or to get closer to the social and economic problems that our population was facing. And that's why the integration between geospatial and statistical information was essential in order to provide granular information that was better aligned not only with the requirements of our stakeholders, but also with the general approach of the Sustainable Development Agenda, and more specifically with the Sustainable Development Goals. In this moment, you are seeing what we call the GIS image viewer of multidimensional poverty in our country. Due to the integration of administrative records and the population and housing census, we managed to develop a per street block multidimensional poverty index that was the keystone in order to go and to develop a COVID-19 vulnerability index that was showing how not only from the socioeconomic perspectives that are addressed in the multidimensional poverty index, but with the health records that from the individual perspective we had access from the Ministry of Health, we managed to develop a vulnerability index that was able to approach the risk of complexities if people in a very specific street block in every municipality in our countries got infected from the coronavirus disease. In these three main issues that we wanted to share with you today, we were looking forward to insist on the fact that the institutional framework and the innovation approach that was fostered from the international statistical community were essential in order to ensure the quality, confidentiality, and professional ethics of statistical production during this current pandemic. At the same time, this had several specific measures from the organization perspective as the tiger themes that we were mentioning before, and at the same time, in order to provide sound and granular information, we understood that we could face ethical challenges in the disaggregation of information, and that's why, in a very rapid way, we managed to develop what we call the Colombian statistical ethics system that in Spanish we call SETE in our country. But more specifically, all this organizational innovation in social and institutional framework make very, very relevant the updating of the legal framework of statistical production in our country. That's why we accelerated the development of a bill of law that was going to update the statistical framework from the legal, institutional, and organizational perspective of official statistics in our country. And taking advantage, again, of a very leading example of regional cooperation among the statistical offices, in the ECLAC, we managed to develop a generic law of official statistics for Latin American and Caribbean countries that we rapidly adapted to the specificities of the Colombian legislation and the Colombian institutional framework. And we are able to put in a high level of importance the statistical independence of the National Statistics Office of Colombia, and at the same time, how the institutional framework of the national statistics system was going to be functional from the legal perspective, and finally, how we were going to ensure periodical statistical production regarding census, for example, population census every 10 years, economic censuses every 10 years, and the updating of the main sources of statistical production for the national accounting system of our country. That's why we wanted to highlight that institutional frameworks, international capacity development from the statistical perspective, and a risk-prone approach to take advantage of the challenges of the COVID-19 as an innovation catalyzer were very important in Colombia to provide sound answer from the statistical perspective to our society. Thank you very much.
Thank you, Juan Daniel, for an extremely interesting presentation on how DANE has addressed the challenges posed by the pandemic. Our second speaker is Ms. Mercy Kanyuka, the Commissioner of Statistics in Malawi. A seasoned statistician with over 30 years experience, Mercy Kanyuka has served in senior management and strategic leadership positions for over 20 years. She's been the Commissioner of Statistics, Head of National Statistical Office in the government of Malawi since February 2014. And in that position, she's also the coordinator of the National Statistical System. Ms. Kanyuka, you have the floor. Over to you.
Good morning, good afternoon, good evening, depending on wherever you are. My name is Mercy Kanyuka. I am the Commissioner of Statistics in Malawi. I would like to share the Malawi experience from COVID-19 in the role of the National Statistical System. The mandate of the National Statistical Office is to produce and coordinate the production of official statistics under the Statistics Act of 2013. We have been adversely affected by the pandemic, especially in the area of data collection. The practice is that we conduct household-based surveys as well as surveys of businesses in the country. And these surveys are usually physical surveys, mostly physical surveys. We do go out to the households with questionnaires. We do go out to the businesses, especially small scale and medium scale businesses, with questionnaires. to conduct the various surveys, and this has been adversely affected. I remember during the onset of the pandemic, we had teams in the field. One team was conducting multiple indicator cluster survey. We had to recall that team. There was another team conducting integrated household survey. This is a living standard measurement survey. We also had to recall that team. We had 2 other surveys in the field. We had to recall all of them back to the office. Until when we put necessary precautionary measures in place, then we had to redeploy the teams back to the field, and that added costs, additional costs of face masks, additional costs of sanitizers, face masks, not only to the enumerators but also to the respondents. So we had to add to the budget of the various surveys. Another area where we have also been affected is the dissemination of major results of surveys. We have been in the past conducting national workshops, regional workshops, just to disseminate our data, and it was actually very effective. But now we have to just use online dissemination, and as well as just inviting a few stakeholders and media houses to help us disseminate the information. It is not as effective as it used to be, but we just have to live with the pandemic until when things improve. What have been the service or the role of the National Statistical System? The National Statistical Office offers a supervisory role. We do second officers to various ministries, including Ministry of Health, and we supervise these officers. So the statistics which have been the Ministry of Health has been releasing on a daily basis are the statistics which are helping the country to monitor the incidence and prevalence of COVID-19 pandemic. So on a daily basis, we get statistics on new cases, statistics on cumulative confirmed cases, statistics on total people who have recovered from the pandemic, statistics on active cases, and even statistics on the recovery rate, statistics on positivity rate, as well as most recently statistics on numbers of people vaccinated. This is very, very useful information which has helped and is continuing to help monitor the progress of the pandemic. And it has been helping to also make decisions on when to relax the preventive measures, as well as even when to reinforce and put back strict precautionary measures, especially in terms of gatherings. The numbers are being limited, or the rules are being relaxed depending on the positivity rate. The positivity rate is the rate which the government is really basing their decisions on, and this has been very, very helpful. The National Statistical Office data provided on poverty also helped to make necessary interventions. The government used the poverty rates of the various cities, the various districts, to target interventions, since most of the households needed to be cushioned on the impact of the COVID-19, especially the poor households in the rural areas as well as the urban areas during the peak of the pandemic. We also had to conduct special COVID-19 surveys as an office. So we conducted, in collaboration with the World Bank, a Malawi high frequency monthly phone survey on knowledge and impact of COVID-19. The survey's aim was to assess the impact of COVID-19 on welfare of households, since the government imposed guidelines and restrictions on movements in the economy. So there were obviously people who were impacted and negatively impacted, and the survey also sought to determine the welfare of the households. There were also some modules which looked at the health, access to health, household amenities, education, employment, and family business. Then there was another parallel survey where we were monitoring on a monthly basis the poverty as well as feedback on monitoring systems of household well-being. Some questions on the impact of COVID-19 on health and education were also included. But this was a parallel survey which NSO was also involved in with another institution. We have also been helping other research institutions on sampling designs as well as providing mapping tools and some technical assistance to enable them to conduct specific district-specific, regional-specific surveys, which they sought the technical assistance from NSO, and we were willing to actually assist the various research institutions. We also collaborated with some other research institutions on COVID-19 impact surveys. So we collaborate with the Catholic Relief Services Resilience Project, which was tracking the impact of COVID-19 on a monthly basis. We also collaborated with the University of Malawi just to look at the impact of the COVID-19 pandemic on education, especially education enrollment. We have had challenges. And the most observed challenge is on the figures which are being released. We get these figures at a national level, and also some figures from district level. So they are disseminated by district. We don't have figures by localities. And these figures by localities would be very useful, because then they would help in targeting. So we know that in the district there are so many people who are ill, others are hospitalized. Okay, when people are hospitalized, then we know where they are. But if these people, the people who are not hospitalized, then they are in their localities, we don't know which locality has got these people. What is the solution to this? The solution is to link the HMIS data, which is actually capturing these various cases, incidents, and link them to the national IDs, so that we get the information by locality, whether a locality has got some cases or no cases, so that proper targeting can be made. So that's the way. That's how it can be resolved. Another major challenge is limited resources to carry out all the planned surveys for the office. Most of the activities at National Statistical Office, as well as in the line ministries, have stalled because data is not being prioritized. Apart from just cases of COVID-19, but any other data collection instruments, any other data collection activity is not being prioritized anymore. To get the real impact of COVID-19, we need to go out and conduct surveys. We need to go out and collect information. We need to conduct a DHS, so that we are able to get the full impact of the disease. But now with limited resources, that is not possible. We just have to see how we can use mobile surveys as well as online surveys to see how we can conduct these studies. We should also bear in mind that using online surveys, mobile phone surveys, we will be leaving out the hard-to-reach households, where there is no mobile facility, where there is no network. Some households which don't even have the mobile phones, those will probably will have to be left out, and that will be a challenge. We have to see how we can actually go around and be able to address even those, be able to target even those who don't have access to a mobile phone, don't have access to any online channel of data collection. Thank you very much for your attention.
And thank you, Ms. Kanyuka. I would like now to turn over to our third country presentation. This is from Mr. Asaf Yungchun, Director General of Statistics Research Institute, the state-run think tank of official statistics and data innovation in Statistics Korea. Mr. Chan is a journalist turned sociologist with his interdisciplinary research career beginning in 1989 at the University of Michigan. He continued in the interdisciplinary research by working as research chief for the Decennial Directorate at the Census Bureau, and has been a senior survey methodologist at the University of Chicago and many other positions. He has served as program chair of ASI Survey Research Methods section.
Hello, everyone. I'd like to talk about pandemic newscasting to nudge science-based policymaking in Korea. I'm the director of Statistical Research Institute of Statistics Korea. My co-authors of this paper are Paul Choi, Eun Jung, and Eun Kim. I'd like to acknowledge my co-authors, as you can see here, including my colleagues at the University of Toronto and other people in Korea. Basically, I'd like to talk about why we are doing science-based policymaking, and I'd like to talk about three phases of this evidence-based policymaking we are carrying out in South Korea. First, why science-based policymaking? I'd like to remind all of us this paradigm shift towards evidence-based policymaking started in the UK back in 1997. And Prime Minister Tony Blair initiated this evidence-based policymaking on behalf of the people in the UK. President Roh Moo-hyun of South Korea established the system of evidence-based policymaking in 2007. And as you know, President Obama of the United States launched Evidence-Based Policymaking Commission in 2013, followed by a series of institutionalization across the federal government. As you can see in this graph, we used to have pretty much gap between ideology-based national policy and science and democracy-based social progress. And we try to reduce this gap between personal ideology governing a nation and scientific and rational governance that people wish to go after. And evidence-based policymaking is the result of that kind of gap reduction. Again, I'd like to say very briefly, we started this kind of evidence-based policymaking around the issue of the COVID-19 with University of Toronto in Canada. And Prime Minister of Jung Se-gyun of South Korea and Deputy Prime Minister of Canada, Chrystia Freeland, started collaboration over COVID-19. And a lot of things that I'm going to talk about today are based on this collaboration between South Korea and Canada. Let me briefly talk about the foundations of the data science, especially when it comes to COVID-19 and its prevention. I'll talk about reproduction number very briefly, why we have used the so-called IDEA, and I'm going to talk about evidence-based response to STEM crisis. Assessing reproduction number in COVID-19 pandemic is essential to designing and implementing non-pharmaceutical interventions. I'm not going to talk too much about statistical components of my talk. Basically, reproduction number itself is the function of probability of infection, contact propensity with infected, and the duration of the spread by the infected. And that is what I basically show on this slide. And science-based non-pharmaceutical intervention is essential to controlling the three factors affecting reproduction number. This is the sort of theory behind it. I'm not going to talk about it too much. And this is the main source of the idea, so-called exponential, the incidence decay with exponential adjustment model that we have used for building and applying to Korea. Let me talk briefly about dynamic distancing we have used in Korea. When you have this kind of pandemic, and then when you try to use a lot of different kinds of non-pharmaceutical interventions, as you can see on this graph, without the interventions, we are going to have pretty much high peak of infected cases, as you can see in kind of blue, the shape on this slide. When we have pretty good control of social distancing, masking, and other kinds of non-pharmaceutical interventions, we can control it under the threshold a nation can actually control. And that is what you can see in this wave-like sort of pattern when you have those things well under control. We have used this SIR-based modeling and experience to stem this crisis in Korea. And I like to say this epidemic modeling is science and art, because we have to use this model-based methodology in a lot of different situations in Korea. And basically it is to reduce uncertainty. And eventually we like to do neo-casting to carry out evidence-based policymaking. In the case of Korea, we started laws after the MERS outbreak back in 2015. And we have continued a lot of advancement of smart quarantine info system. In 2017, we created big data system for precision tracing in 2020. And then based on all this kind of legal foundation, we are able to locate data shared with the public evolutionarily with a higher level of privacy. And that's what I show on this slide. Let me illustrate a few points here to show how this the idea-based modeling actually started. Back in March last year, we initially started this idea-based modeling to focus about 11,000 cases by the end of the March. And that's what you see on this model. Based on this limited number of the infected cases, we could actually come up with what could happen after a month or 2 months later. And actually, when we compared this model-based cases with actual data, they are pretty consistent. We also try to measure this reproduction number over time, so we can see how things are happening. And as you can see here, this reproduction number has declined over about 2 months from February and then March back in 2020. And we also try to see whether this kind of modeling is going to work in the local area in southern region of South Korea. So what you see here is that based on this particular cases with very, I think, a limited time frame, we're able to model and show how it is going to actually decline over time. And usually, I think in the past, we could say when we have very important intervention, its effect usually happened about 2 weeks later. And that's what you see here. When we had this peak of infected cases, if the intervention worked pretty well, it actually had its effect after 2 weeks later. What could have happened if we didn't have any good sort of non-pharmaceutical interventions? And this is very important information that I think the policymakers like to know about. So we actually try to model what could happen without the intervention and with intervention. So here, back in 2020, sometimes last, the March and April time period, and we had pretty strong interventions in a national scale. And if we didn't have those kind of interventions, this slide actually shows we could have over 3.4 million infected cases by the fall of 2020. That did not happen because Korea was able to control things with pretty good series of non-pharmaceutical interventions I just talked about. This is another sort of, I think the illustration to show you how this model, I think they were created again and again over time, and to show how the cases will be declining over time and when it is going to reach the peak. This is another modeling to illustrate how we actually created actual pattern in one of the local areas. Like I said, we keep trying to measure reproduction number over time. This is very critical information we need to have under our radar. Again, this is another modeling we did June last year to see how we can control this, another wave, second wave of the pandemic in Korea. And we were able to come up with pretty nice model based on very limited data. And then we came up with pretty good interventions. One thing I'd like to tell you about this is that when we had the modeling and also some kind of, pretty good system of interventions, how we could confirm it. Statistical Korea and NSK actually partnered together to do some kind of big data analysis based on mobility of handphones, so we can estimate mobility flows. This is actually to confirm whether people moved in response to these interventions we created, so we have pretty good social distancing. So we could confirm whether the model is going to work or not based on actual mobility people actually showed in response to the governmental interventions. And as you can see here, we have pretty good pattern of how Korean people were in compliance with this mandated social distancing over different time period. I like to say over time, we continued adapting this modeling to different needs. So initially we started with this SIL-based idea model, but we had some other variants. So we can handle this crisis better and then come up with a better estimation and prediction, and then do pretty good evidence-based policy making. So we had SEIR model, SEIQR model. Also, we had data simulation, and also we have segmented Parson model with policy variables. These are all different variants of the SIR model we have used. This is one of the examples I can point out. In the back in, I think, the middle of last year, we had also another test and then modeling, and it worked pretty well. And this is another illustration we did, back in December 2020, and then showing what kind of predictions that we had, and then actually the data followed pretty well. And another example, I don't have time to explain all the details. So what is the next phase? I'd like to say three things in conclusion. We continue to have evidence policymakers in place. When you have good statisticians, data scientists, and other scientists, if you do not have the policymakers in place who do well understand evidence-based policymaking, I think all this prediction may be useless. And Korea was very good to have good leaders in place. I like to say we need blue data designers in the future. What do I mean by that? We have a data lake to store the data. We have data mountain to keep archiving good quality data. We need to have the data ocean to share a lot of data. And I call all those assembled together as blue data. And we need to harness multiple sources of data and data linking so we can have pretty good blue data system to stem the future pandemic crisis that might be hitting the planet again and again. We also need AI and data science-based series. I think that we are just part of this so-called AI data science-based series. We need to have more people well-trained, well-prepared, And all these people need to be partnered together across the continents so we can be better prepared for the future pandemic. Probably I don't have time to go over some other slides that I have, but I think what I just mentioned is the end of my talk. And I just like to share with you this good painting by John Miller. It's titled The Seers. He painted this thing back in 1971, and when he looked up the heaven in Spain, and then he tried to actually see the future based on his painting and conceptualized in this series. Today, we have a lot of data scientists, good statisticians, good policymakers. If we can work together, we can see the future better with all this good data and an AI-based tool. And so we are all the seers. And I'd like to ask many of you to join this group of the seers to handle the future crisis better. Thank you.
Thank you so much, Mr. Chan, for the very interesting presentation. I'd like now to turn to our colleagues from the Office for National Statistics in the UK. We have a joint presentation by Ms. Esther Sutherland and Ms. Ruth Studley. Ms. Esther Sutherland is Head of Strategic Development for the COVID-19 Infection Survey. She's responsible for stakeholder management, collecting user requirements, briefing and reporting, and delivering on other strategic analytical developments across the division. She has also worked on the 2021 census, social survey data collection, the race disparity unit, and within the National Statistician's Private Office. Ruth Studley joined ONS in June 2020 and has a number of years' experience leading multidisciplinary teams working on health statistics and research. Additionally, she has led various health policy and health regulatory roles. Ruth has a particular interest in producing statistics and intelligence to inform decision-making. Dear colleagues, you have the floor. Over to you.
Hi, my name's Esther and I'm from the Office for National Statistics here in the UK. I'm Head of Strategic Development for the COVID-19 Infection Survey, which I'll tell you more about soon. Today in this presentation, I'm going to talk to you about some of the health statistics we have produced in response to the pandemic. ONS has a long-standing role in reporting statistics on health from admin data and survey data. Our analysis is widely used for public policy decision-making. From March 2020, the country turned to ONS's reporting of deaths to understanding the pandemic, as well as evidence to support government decision-making from our social and business surveys, public policy analysis, and economic statistics. As our offer expanded to support in government decision-making, we increased the data we collected and the analysis we produced. We introduced the Health Analysis and Pandemic Insights Directorate to bring together the health and pandemic-related analysis we produced. So firstly, let's look at some of our data sources. In England, deaths are legally required to be registered by the local registration service in partnership with the General Register Office. Coding for cause of death is carried out according to the World Health Organization definitions. There are various layers of verification of death certificates, and sometimes deaths are referred to the coroners. We receive this data and produce and publish analysis from it. Moving on to the COVID-19 infection survey. Given the weight of the pandemic, there was a need for a new community-based survey to be set up to understand the levels of COVID-19 in the population. ONS responded to this requirement through collaboration between the private sector and charitable organisations, including IQVIA, NatSen and Ipsos Mori, working with the UK Biocentre and University of Oxford to collect and process swab and blood samples. The COVID-19 infection survey is a large-scale longitudinal household survey. The sample is drawn from our address base at random and so is representative of the country by age, sex and region. By community in this instance, we mean those in private residential households as opposed to settings such as hospitals. At the start of the pilot stage of the study, we invited around 20,000 households in England to take part, anticipating this would result in roughly 21,000 individuals from around 10,000 households participating. Since the end of July, we have further expanded the survey and now have over 150,000 households across the UK taking part, totalling over 400,000 individual participants aged 2 and over. Our devolved administrations also decided to participate in the survey, and so we began data collection in Wales in June 2020, in Northern Ireland in July 2020, and in Scotland in September 2020. Participants are asked to provide a swab test once a week for the first 5 weeks they are in the study, and then once a month thereafter. This swab allows us to test if the individuals are currently infected with COVID-19. This allows us to provide both a positivity rate, which is the number of people with COVID-19 at a point in time, and an incidence estimate, which is the number of new infections. A large proportion of participants aged 16 and over are also invited to provide a blood sample through a capillary blood test. We use these blood samples to test for level of COVID-19 antibodies. We also collect data which tracks demographic and behavioural information, such as where someone lives, where they are working, and how they might be travelling to work. And we use these data to produce modelled estimates of the numbers of people likely to test positive in the UK. Crucially, as our survey doesn't rely on people coming forward for testing, we can more accurately capture things like asymptomatic infections. The final source of data I want to talk about today is our schools infection survey. The schools infection survey investigates the role of schools in COVID-19 transmission and how transmission within and from school settings can be minimised. A random sample of schools in England were asked to take part in COVID-19 testing as part of the study to find out how many school pupils and staff have had the infection, how many have developed antibodies against the virus, and how this changes over the course of the year. The study is conducted by Public Health England in partnership with the Office for National Statistics and the London School of Hygiene and Tropical Medicine. 150 schools, 50 from primary and 100 from secondary, are participating in the study. In primary schools, the average enrolment is 280 pupils, and in secondary schools is 990 pupils in 2 consecutive year groups. The study oversampled schools in high-risk areas of the country. 10 local authorities were taken from this group and 5 from the remaining local authorities. Repeat surveys and testing every half-term were carried out to collect risk factor information with virus and antibody samples in a cohort of pupils and staff throughout the academic year. So as I said earlier, data from these various sources have been used throughout the pandemic to understand what was happening at the single points in time and help to inform specific policy interventions that the government defined. So now I'll talk you through some of those pieces of analysis we have produced that the government have been able to use. From the COVID-19 infection survey, we produced modelled estimates to understand trends in positivity for all 4 UK nations. After the first national lockdown, the government introduced a local approach to interventions, including different tiers of interventions. We produced regional analysis throughout the summer to give an indication of the levels of positivity in the regions of England and how they may be changing. Around October time, as I said, we increased our sample. We also then had sufficient enough numbers in order to produce sub-regional estimates. And this allowed us to demonstrate to policymakers a further detailed breakdown to identify areas of concerns for this tiered and regional approach to policymaking. In December 2020, the emergence of a new UK variant of the virus was spreading. As the infection survey has a representative sample in the community population, our data was vital in understanding the prevalence of this new variant. The new variant of COVID-19 was found to have genetic changes in the S gene, and this meant the S gene was no longer detected in the existing COVID test. Our analysis of these gene patterns of positivity identified that through November and December, there had been an increase in the percentage of positive cases where the S gene had dropped out. This analysis was the primary source of evidence to support the government introducing a Tier 4 stricter intervention over the Christmas period for parts of England. Across the pandemic, we have also looked at various situations that might change an individual's risk to getting COVID-19. For example, we looked at travel to work and found that those who travelled to work were more likely to test positive for COVID-19 than those working from home. Equally, those who found it more difficult to maintain social distancing in their workplace were more likely to test positive as well. So as I mentioned, we did already produce deaths analysis before the pandemic. However, we've undertaken lots of different pieces of work to expand upon this analysis, which I'll talk through now. Before the pandemic, we released weekly data of the number of deaths in England and Wales, including breakdowns by sex, age, and region of England. During the pandemic, we increased our analysis to include analysis on deaths involving COVID-19, which included age-standardized mortality rates and deaths involving COVID-19 by local areas. We also produced analysis on COVID-19 mortality by ethnicity, religion, disability status, and occupation through linking mortality records to the 2011 census. Finally, we produced analysis on excess mortality that was not due to COVID-19. We were able to significantly increase the amount of mortality data we were able to produce on COVID-19 as a result of data linkage, for example, to the public health data asset and to the census 2011. For example, from producing analysis on this linked data, we were able to find that large ethnic inequalities in COVID-19 related to mortality. We found some of this inequality could be explained by socio-economic conditions and pre-pandemic health, but not all. We also found changes in the differences between the various waves of COVID-19 in the country. This chart shows the evidence that we found all ethnic minority groups were at an elevated risk of COVID-19 related death in Wave 1. And this chart shows that in Wave 2, the risk remained elevated for South Asians, but less so for other ethnic minority groups. The final analysis I want to briefly cover is that produced from the Schools Infection Survey. As mentioned, from the Schools Infection Survey, we were able to look at rates in schools within pupils and staff. So on the left, we have the percentage of primary and secondary school pupils testing positive for COVID-19 across the various rounds of the study. And on the right, we have the same but for staff. There are various lessons we have learned in the Health Analysis and Pandemic Insight Directorate over the course of the pandemic. Some of this is around how we communicate complex technical information. Some of it is around how we ensure that our data is of high quality as well as accessible, and that we meet the needs of varying users, not just government decision makers, but also the general public, the media, and academics. We've really benefited from the ability to partner with academics who have really improved the analysis we've been able to produce, and also that we have been able to upskill our workforce in order to continue to meet the demands of the pandemic. Thank you for taking the time to listen to this presentation, and please feel free to get in touch if you have any additional questions.
Thank you very much. We've now heard from national statistical offices how they have addressed the many challenges of the pandemic and the key role they have played in national efforts to address and mitigate the impact of the crisis. It is now my pleasure to introduce Ms. Mark Hereward, Associate Director for Data and Analytics at UNICEF, who will talk about data preparedness in countries in situation of conflict and vulnerability, countries where UNICEF has been working and providing support to governments. Mr. Mark Hereward has been Associate Director for Data and Analytics at UNICEF, where he leads the team that collects, assesses, analyzes, stores and makes public data and statistics on the situation of children and women. He joined UNICEF in 1995 in the statistics section at headquarters, UNICEF headquarters in New York, subsequently moving to UNICEF China, and then over to UNICEF Regional Office for East Asia and the Pacific in Bangkok as Regional Planning Officer. Dear Mark, you have the floor. Over to you.
Good day to everybody who is joining this international conference on the use of big data in official statistics, my favorite meeting of the year. And whether it's good morning, good afternoon, or good night, I just want to express how privileged I am to be able to share some thoughts with you today. Of course, we're all looking to see how we can learn from this long, drawn-out, massive emergency that the COVID pandemic has brought along. And it has affected every part of our lives. And of course, the national statistical systems are not immune to COVID, just like anything else. And this particular session, we're looking to see what lessons we can learn in terms of building resilient data and statistical systems. And one element of that I want to argue today is the whole concept of data preparedness. This is the data equivalent of pre-positioning of supplies, of having emergency plans ready in place and for different scenarios. In the same way, we need to be prepared with the data and statistics for when, and it's always when, not if, different kinds of disasters can strike. I'm going to be using a non-COVID example to illustrate, but of course the principles apply throughout. So I have a colleague who went to Sudan, in fact to Darfur in Sudan for a 3-month assignment recently. She just came back. And we had asked her to go there to see how to make into practice these ideas that we had on data preparedness, but also on what we call data savvy, which is the confidence and comfort with using data, and of course the competence and commitment to using data, which we also argue is essential to data making a difference for children, for people in general. So what I'm showing on this slide is a map that she made. And what's amazing really is that this was the first time, when she put this map together, it was the first time that government or UNICEF saw these data all in one place. The data existed, they were from different surveys by government and by the UN system and a couple by NGOs, but they had never been put together in one place with an operational overview to be able to answer operational questions to be able to make a difference. So the questions were simply, where are the most vulnerable children and what services do they have? And the first lesson you draw from it really is, of course, that more data are available than we know. But data is just one of the building blocks necessary to using data to make a difference. So if the 4 building blocks are data and talent and technology and funding, data availability is important, and the data availability to be able to answer the questions that are needed. But also there's the data savvy, the talent is the data savvy concept that I was talking about before, and the technology to put all these data together in a way that they can and will be used. But we need all these in place, and of course the funding to be able to make them be in place for the data to start making a difference. And beyond that map, our colleague then went into creating what she called the data pocketbook, which is like a dashboard really to answer the question, are we doing the right thing in the right place for maximum impact, in this case for children? And it's based on the premise that what's needed are fast feedback loops. Feedback both on how the situation is changing and feedback on how the programmatic impact is happening because of the interventions from government and others. And it's with those fast feedback loops, which come across the whole of the national statistical system, that we can then be sure that what we're doing is having the maximum impact, because we never have enough resources to be able to have the impact we need. So we need to make sure that we're targeting it most precisely for the maximum effect. And I just want to reiterate that the demand for data is as important as the supply of data. The systems are necessary, but not sufficient condition, the economists would say, to be able to make a difference, for the data to be able to make a difference. And overall, from this exercise, we we bring a main conclusion, which is that a no regrets approach to data preparedness is really essential. It's, I think the Americans would call a no-brainer. Preparedness in general, it makes things more efficient, and data preparedness must be the same. An evaluation by DFID, as it was then, on the emergency response of UNICEF and World Food Programme concluded that $1 of preparedness saved $7 of operational expenses when an emergency did hit. I'm sure that same kind of ratio would apply to data preparedness as it would to the other kinds of preparedness that they were looking at. And what does that preparedness mean? It means having a common operational data set, common between the national statistics offices and the ministries, to know the number and position of the population of concern, and the extent and the geographic distribution of service provision before a disaster happens, so that we have a baseline, and so that we can look at the extent of service disruption and the population movement to see how services need to be recalibrated to be able to have the maximum impact to reach those who need it most. We can assess the disruption, we can do our monitoring, we can do our evaluation, the whole time looking both at the statistical data on the situation and on the operational data on what is being done to help those people, all with geospatial analysis to be able to make sure that we make the biggest impact possible. So that's my plea for data preparedness. I absolutely believe in it fully, and I would look forward to seeing how we could use big data, rapid surveys, statistical data, all the different sources to bring together so that we're ready when a disaster happens and we can be the most effective in reaching those who need us most. Thanks very much.
Thank you so much, Mark, for the very, very interesting presentation. This concludes the interventions by our panelists. From what we heard today, I think it is evident the national statistical offices have played a key role in the response by governments to the pandemic. And in general, their contribution to responding to disasters is critical. It is also important to note that those countries where the process of transformation and modernization of the data and statistical systems was well underway, like in the case of Colombia, were able to quickly adapt to the new circumstances and to even accelerate their journey to innovation. We've also heard about the critical importance of data preparedness, being ready with the key data sets from all different data sources that can support the immediate response when the disaster hits. We'll have an opportunity to further reflect on many of the important points that were raised today by our panelists, both in the rest of the sessions during the conference, but also at the round table on our third day, when we will sort of summarize and reflect on the various lessons learned and the experiences shared by all our participants. For now, let me thank the speakers once again for their incredible contributions, and thank to the audience for their attention. And I wish you all a very good rest of the day wherever you are. Thank you so much.
We hope you enjoy this session on national experience from COVID-19. This concludes all the session in day one of the International Conference on Official Statistics. I'd like to thank all of the session chairs and the speakers for sharing their insights, and thank our participants for joining us today. The conference will resume tomorrow at the same time as today, that is 8:30 a.m. in Seoul, 1:30 a.m. in Geneva, and 7:30 p.m. on August 31st in New York. We look forward to seeing you. Thank you all.